My name is Brenda Cron. I'm from Arlington, South Dakota, and I work as a manager at the 1481 Grill in Arlington. I like to crochet. I also like to work in my rock garden and spend quality time with my kids. In August 2013, I went in for an annual blood panel with my local clinic. Found out that my white count was low. A month later, they asked me to come back and have it checked again. So I went in and my white count was very low. So they sent me down to Sioux Falls. We did a biopsy, found out that I have APL leukemia. I had 10 weeks of chemo at Brookings, and I would have lab every day. I would have an EKG 3 times a week there. I also have them change my bandage. I have a trifusion catheter, and so they change my bandage and my caps. Right now I'm still going in about once a week for blood work. That will continue on. Blood work will be once a month for me for the next 2.5 years. I couldn't imagine having to drive down to Sioux Falls 5 days a week, 180 miles round trip for 10 weeks. And so I asked if I could have this done at Brookings Hospital. And it was a great relief when I found out that they could accommodate my needs. We would do labs in the morning and EKGs, and those findings were sent down to Sioux Falls. And then I would wait in the chemo room for the results and to get the okay for chemo. And while I was waiting there, I could watch TV. The nurses always made sure I had a warm blanket and a Diet Coke because they knew me very well. And then I would watch on my Nook, I would watch movies or I would watch TV, things like that. When I walked in the door, they called me by name. It was an individual, not just a patient. They made sure I was comfortable. And a lot of times they would ask me how I'm doing, and they would genuinely want to know how I was doing. It wasn't just saying, well, how are you today? And, expecting, oh, I feel good or whatever. They really wanted to know how I was doing. They're great to work with. I worked with, from the receptionist to the ER nurses, the lab. I worked with cardiology, even the front desk, scheduling appointments for me. And they always made sure I got in right away. The ER receptionist always made sure that I got into the room right away, and then I didn't wait not even 5 minutes, and the ER nurse was there and taking care of me. They were just so pleasant and just so real when you walk through the door. I mean, even if I wasn't their patient, they would come in and at least say hi to me, ask me how I'm doing, or visit with me, or ask me what I was watching on my Nook, things like that. I mean, they just really cared. You're not just a patient, like I said, you're an individual. And they should be really commended for what they do, because they just, like I said, they made a bump in the road or a bump in the journey of life just a lot less rough for me. And I'll be seeing them for the next 2.5 years, once a month, and I'm sure everything will be the same.